Complications of pregnancy and dangers to the fetus. The United States is currently ranked 60 out of 180 countries in maternal deaths occurring during pregnancy. That is, for every 100,000 births in America in 2013, 18.5 women died. This compares with 8.2 women died or who died during pregnancy at birth in Canada, 6.1 in Britain, and only 2.4 in Iceland. Researchers are not sure why this is happening, but are almost in a unanimous agreement in pointing to the lack of access of health care, coupled with rising levels of poverty. Effects of teratogens. Substances other than nutrients may reach the developing embryo or fetus through the placenta. Although few extension studies have been done on the subject, toxic substances and the environment can also affect the health of the fetus. Whatever a woman breathes, eats, or drinks eventually received by the conceptuous of in some proportion. A fetus's blood alcohol level, for example, is equal to that of the mother. Teratogens are substances other than factors that can defect the brain, damage or physical deformities in the developing embryos or fetuses. In fact, an estimated 10% of birth defects may be caused by teratogens in the environment. Alcohol. Studies have linked heavy or chronic ingestion of alcohol during pregnancy to fetal alcohol syndrome, better known as FAS, which can include unusual facial characteristics, small head and body size, congenital, which can include unusual facial congenital heart defects, defective joints, and intellectual and behavioral impairment. About half of all FAS children are developmentally disabled. Non-parental consumption of alcohol without the association of facial features of FAS is linked to fetal alcohol effect. Children with FAE often may have the same symptoms and issues of the FAS, including intellectual and behavioral deficits. Tobacco. Maternal cigarette smoking is associated with spontaneous abortion, persistent breathing problems, and a variety of complications during pregnancy and birth. Other drugs, infectious diseases, sexually transmitted infections, maternal obesity, pregnancy after the age of 35, ectopic pregnancy, which an ectopic pregnancy occurs in about 1 in 50 pregnancies. The fertilized egg grows outside the uterus, unusually in the fallopian tube. Pregnancy-induced hypertension, which is characterized by high blood pressure and anemia, along with protein in the urine. It can occur after 20 weeks of pregnancy or shortly after delivery and affects 3 to 5% of all pregnancies in the United States. Preterm births. Births that take place prior to 37 weeks of gestation are considered to be preterm births. About 11% of all pregnancies in the United States result in preterm births. A consequence of this is low birth weight infants. those who weigh less than 2,500 grams or 5.5 pounds at birth. About 35% of infants' deaths in the United States are associated with preterm birth-related causes, more than any other single cause. Diagnosing fetal abnormalities. They carry screening tests, which can be done before or during the pregnancy. The cyst fibrosis carrier screening is also offered to all women during the reproductive age. Screening tests assess the risk that baby will have Down syndrome, other chromosome problems, as well as neural tube defects, but not all indicates whether the fetus actually has these disorders. Diagnostic tests can provide information about whether the fetus has genetic conditions are almost commonly done through the ultrasound. Chronic villus sampling, SVS, involves the removal of a small sample of cells taken from the placenta sometime between 10 and 13 weeks of gestation. Amniocentesis involves the withdrawal of a small amount of the amniotic fluid from the uterus at 14 to 20 weeks of gestation. The risk from the loss of amniocentesis is 1%, while for CVS it's from 0.6 to 4.6%. Neural tube defect screening performed on the mother's blood to measure the level of alpha fetoprotein reveals possible defects of the spine, spinal cord, skull, and brain. This test should be offered during the second trimester to women who elect to only first trimester screening for Down syndromes. Other tests can be performed to provide other information. Pregnancy loss, miscarriage. A spontaneous abortion or miscarriage is a powerful natural selection force in bringing healthy babies into the world. About 10 to 15% recognize pregnancies end before 20 weeks gestation, but as many as half of all pregnancies may end in a miscarriage because many losses occur before a woman realizes she is pregnant. Many of these, more than 50%, happen because of the chromosomal abnormalities. The first sign that pregnant women may miscarry is vaginal bleeding, which is called spotting. If a woman's symptoms of pregnancy disappears and she develops pelvic cramps, she may be miscarrying. The fetus is usually expelled by uterine contractions. Most miscarriages occur in the first 13 weeks of pregnancy, which is the first trimester. Infant mortality, because factors that affect the health of the population often impacts infants. The infant's mortality rate is often used as a barometer to measure the health of the well-being of the nation. Although many infants die of poverty-related conditions, including lack of prenatal care, others die from congenital problems, conditions appearing at birth, or from infectious diseases, accidents, or other causes. Sometimes the cause of death is not apparent. More than 4,000 infant deaths per year are attributed to sudden unexpected death. Infant death, which is SID, S-U-I-D. Sudden infant death syndrome, which is SIDS, is one type of SWAID, which is SUID, whereby an infant is less than 1 year of age dies from unexplained causes. SID is the third leading cause of infant death in the United States and leading causes of death in infants 1 to 12 months. Infertility. Infertility is defined as a lack of pregnancy in the last 12 months despite having an unprotected sexual intercourse in each of those months with the same partner. Women who do not have regular menstrual cycles or are older than 35 years and have not conceived during a 6-month period of trying should consider seeing an infertility specialist. Fertility problems are equally likely to be caused by a disorder of the man 30%, disorder of the woman 30%, or both. In cases the cause is unexplained and attributable to both partners. Female infertility, about 11% or 6.7 million women aged 15 to 44 in the United States have difficulty getting or staying pregnant. Male infertility, the primary cause of male infertility is including having a varicocele or varicose vein above the testicle, low sperm count, decreased sperm mortality, and poor sperm morphology. Sperm ducts may have become blocked, or for some reason the male may not ejaculate. While sperm morphology is the best indicator of fertility, sperm counts are used instead because they are easier to perform. Medical interventions for infertility. Fertility medications. A variety of medications can be used to treat infertility. Surgery, artificial insemination, assisted reproductive technology. All fertility treatments in which both eggs and sperm are handled are known as assisted reproductive technology, which are IVF, in vitro fertilization, and this involves extracting a woman's eggs, fertilizing the egg in the laboratory, and transferring resulting embryos into the woman's uterus through the cervix. Intracytoplasmic sperm injections, which is ICSI. A single sperm is injected directly into the mature egg. The embryo is then transferred to the uterus or fallopian tube. GIFT, which is the gamete intrafallopian transfer. This involves the use of the fiber optic instruments to guide the transfer of unfertilized egg and sperm gametes into the woman's fallopian tubes through the incision of her abdomen. ZIFT, the zygote intrafallopian transfer, and TET, which is the tubal embryo transfer. A woman's eggs are fertilized in laboratory with her partner's sperm and then transferred to her fallopian tube on day 1, ZIFT, or on day 2 in TET. You also have the surrogate motherhood and the gestational carrier, which is a woman whose ovaries but no uterus may use a gestational carrier whereby she uses her own egg. Labor and delivery. During labor, contractions begin the effacement, thinning, and dilation, gradual opening of the cervix. It is difficult to say exactly when the labor starts, which helps explain the great differences in the length of the labor. Let me see if I can find something more simple than that. Okay. During the labor, uterine contractions causes the opening of and thinning of the cervix. The length of the labor varies from woman to woman and birth to birth. Encouragement from her partner can help the mother relax. During transition, the mother is coached to push as the baby's head begins to crown. See, the baby's head emerges from the womb. The placenta will soon follow. Okay, so first stage usually lasts about 4 to 16 hours or no longer. Before that, contractions normally takes 2 to 36 hours. At the end of the first stage of labor, which is called transition, the contractions come more quickly and are more intense than beginning of labor. The cervical is opening and is now almost fully dilated, about 10 centimeters, which is 4 inches in diameter. But the baby is not completely in position to be pushed out. Transitions can take from a few minutes up to several hours. The second stage of labor begins when the baby's head moves into the birth canal and ends when the baby is born. During this time, many women experience a great force in their bodies. When the baby's head emerges and does not slip back in when the woman's pushing during birth, is known as crowning. With each of the final few contractions, a new part of the infant emerges. The baby will still be attached to the umbilical cord connected to the mother, which is not cut until it stops pulsating. He or she will appear wet and often to be covered with a waxy substance called vernix. The head may look oddly shaped at first, but molding in soft places of the bone during birth. After the baby is delivered, the uterus continues to contract, expelling the placenta and remaining section of the umbilical cord and at the fetal membrane. Completing the third and final stage of labor, these tissues are collectively referred to as afterbirth. Immediately following the birth, the attendants assess the physical conditions of the neonate or the newborn. The heart rate, respiration, skin color, reflexes, and muscle turns are individually rated with a score of 0 to 2. The total, called an APGAR score, will range between 7 and 10 if the baby is healthy. For a few days following labor, especially if it is the second subsequent birth, the mother will probably feel strong contractions as the uterus will begin to return to in its pre-birth size and shape. This process takes about 6 weeks. She will also have a bloody discharge called lochia.